The European Union, World Health Organization, United Nations World Food Programme and the Pacific Community signed an agreement that will strengthen their existing partnership to support health sector responses to COVID-19 across the Pacific. This follows the new financing agreement the EU and the Pacific Islands Forum Secretariat signed to repurpose funding to support the Pacific's response to COVID-19. Meroni Mili with in-depth.
Addressing the health and socio-economic impact of COVID-19 is a priority for the European Union. $49.4 million has been allocated by the EU to strengthen the medical systems of Pacific Island countries to allow them to deal not only with COVID-19 but all health challenges.
It is not only about COVID-19 but really about improving the quality of the health systems which are made available in the Pacific Island countries by the government of the Pacific Island countries. Let me just underline that to implement this assistance, the European Union decided not to reinvent the wheel or not to add another layer of bureaucracy, but we chose to finance the Joint Incident Management Team, which was set almost a year ago to coordinate the efforts from the governments of the Pacific Island countries, but also donor partners such as the European Union and the international and regional organization in response to COVID-19.
SPC will use this funding for health surveillance, strengthening the One Health approach as well as risk communication.
So this COVID-19 initiative builds directly on that record of achievement. We're especially pleased to be supporting quality assurance and quality control measures as mentioned, and providing technical assistance to COVID-19 testing and surveillance. While we hope and pray that the tragic impacts of COVID-19 ease in 2021, we know that globally we're going to be living with COVID for a very long time to come. And so it's the long-term capability in surveillance that's going to be critical to opening our borders and reducing the socio-economic impacts that have been so devastating for the Pacific, as the Ambassador said.
The EU support will help strengthen testing capacity, WASH, infection prevention and control, and preparedness for the rollout of COVID-19 vaccines.
I recognize that vaccination is certainly the next big step for the world to address COVID-19 and hopefully to overcome this crisis. The European Union has not been inactive on that front. In May 2020, last year, we spearheaded the fundraising effort to raise funds to finance research on vaccines, but also better testing and better treatments. We managed to fundraise 16 billion euros last year. Now that we have vaccines available, I think the next challenge is to make sure that these vaccines are made available to countries such as Fiji, but to the Pacific region as any other part of the world. To that effect, the international community put in place a mechanism which is called COVAX.
The funding comes at a time when Pacific Island countries are preparing for the arrival of the first allocations of COVID-19 vaccines, which are expected in the coming months.
Process for the actual final process for the delivery of the vaccine is still under consideration. It will depend on the type of vaccine that will be distributed in the Pacific and will depend on the cold chain temperature requirements for the vaccine. But if WFP's partners ask us to deliver vaccines on our humanitarian service, we certainly will do so.
The agreement has 5 main outcomes, including increased readiness of countries for effective COVID-19 response operations, with a special attention to those living in vulnerable situations. Meroni Mili, Fiji One News.